This is Jesse Hunt, BNS Chapter 4 Outline, Segment 2, pages 103 to 111. The effects of a drug depend on its site of action. There are drugs which are considered over-the-counter drugs and prescription drugs. Psychoactive drugs alter brain function and affect conscious experience. These can be used in a recreational or psychiatric setting with various health risks. Drugs fit like keys into molecular locks. It is possible to make drugs which fit only a specific receptor or a specific subtype of a receptor. Receptor subtypes differ in distribution throughout the brain, and they serve very different cellular functions. This means that selectively blocking or activating receptor subtypes can have varying effects. Evolution has created more variation in the receptors than in the neurotransmitters. Drug molecules do not seek out receptors. Drugs spread throughout the whole body and happen across receptors which will bind them. Drugs, like keys, fit into a specific subset of locks. They try to fit into all of the locks that they can. Sometimes they can bind to a receptor and either block or unblock activate the receptor. Summary of Table 4.2. Glutamate. The known receptor types are ionotropic, AMPA, kainate, MNDA receptors, and the metabotropic glutamate receptors are mGluRs. The function is the most abundant and most important excitatory neurotransmitter. NMDA receptors are especially implicated in learning and memory. GABA. The known receptor types are ionotropic GABA A and metabotropic GABA B. The function. GABA receptors mediate inhibitory activity in the brain. They counteract the excitatory effect of glutamate. GABA A prevents seizure activity. GABA B is inhibitory by a different mechanism. Acetylcholine. The known receptor types are metabotropic, muscarinic receptors, nicotinic receptors. The function. Both are involved in cholinergic transmission in the cortex. Nicotinic is crucial to muscle contraction. Dopamine. The known receptor subtypes are metabotropic, D1 through D5, and D6 and D7. The function. D1 through D6 are found throughout the forebrain. D6 and D7 are involved in complex behavior, motor function, reward, and higher cognition. Norepinephrine. The known receptor types are metabotropic alpha 1-, alpha 2-, beta 1-, and beta 2- adrenergic receptors. The function. The effects of the visceral organs, sympathetic nervous system response, fight or flight, in the CNS, and it provides an alerting and arousing function. Serotonin. The known receptor types are metabotropic 5-HT1 receptor family, 5 members, 5-HT2 receptor family, 3 members, 5-HT4 to 5-HT7 receptors. 5-HT3 is ionotropic. The function. The different subtypes differ in distribution throughout the brain. 5-HT2 may be involved in mood, sleep, and higher cognition. 5-HT3 is involved in nausea. Miscellaneous peptides. Known receptor subtypes. Metabotropic. Peptides for opiates, delta kappa mu. Cholecytokinins, neurotensin, neuropeptide Y, and many more. Drug-receptor interactions vary in specificity and activity. Binding affinity is the degree of the chemical attraction between a receptor and a ligand. Some ligands bind strongly to some molecules and less strongly to other molecules. Often neurotransmitters are low-affinity ligands. This allows them to dissociate from the receptor more quickly. Efficacy, or intrinsic activity, a ligand's proclivity to activate the receptor that it has bound to after it has bound to that receptor. Agonists have high efficacy and antagonists have low efficacy. Partial agonists. Drugs which produce a middling response when bound to a receptor, it has less effect than the endogenous ligand would. Dose-response relationships reflect the potency and safety of drugs. In general, greater doses equals greater effects. The dose-response curve is the graphed relationship between dosage and observed effects as shown in Figure 4.9. This dose-response curve gives the effective dose ranges, allows comparison of the potency and efficacies, and can give hints as to the number of receptors the drug binds to. We can use these DRCs to help determine which drugs are safest to use. Pharmacodynamics is a collective name for the factors which affect the relationship between drugs and their targets. Repeated treatments may reduce the effectiveness of drugs. Tolerance is a reduction in a drug's effectiveness after repeated exposure to the same dosage. Successfully larger doses are required to cause the same effect. Metabolic tolerance is the body's metabolic response, liver and specialized proteins, to begin more efficiently to digest and eliminate the drug from the system before it can affect the brain or other targets. Functional tolerance, when the target tissue shows altered sensitivity to the drug, usually through up or down regulation of receptors. Upregulation is if the drug is an antagonist, the cell will increase the number of receptors to compensate for the blockage by the drug. Downregulation is if the drug is an agonist, the cell will decrease the number of receptors to counteract the drug's effect. These are shown in Figure 4.10. Cross-tolerance is when an individual's development of a tolerance for one drug leads to the tolerance for other drugs. Withdrawal symptoms are the unpleasant symptom that arise when an individual stops using a drug that they have used with frequency and/or have developed a tolerance for. The fear of this withdrawal symptom leads to maintenance of drug addiction in some individuals. Sensitization is a process where an individual shows enhanced response to a drug after repeated doses. Drugs are administered and eliminated in many different ways. Bioavailable is a drug substance which is present in the body in a form that can affect the target tissue. Smoking or intravenous routes are quick and rapidly increase the concentration of drugs. Oral ingestion routes build up the drug concentration more slowly. Sometimes the drug's metabolites, metabolized form, are active in the body. Biotransformation is the process by which enzymes metabolize drugs into a metabolite which itself is active. This can be the source of unwanted side effects from some drugs. Pharmacokinetics is a collective term for all of the factors which move a drug into, through, and out of the body. Summary of Table 4.3. Ingestion, route of administration, tablets, capsules, syrups, infusions, teas, and suppositories. Mechanisms, absorption by the gut. It's much slower than other routes and is affected by the presence of food. Inhalation, route of administration. Nasal absorption, inhaled powders and sprays, and smoking. Mechanisms, the use of the vascularization of the nose and lungs to convey drugs into the bloodstream. Peripheral injection, route of administration. Subcutaneous, intramuscular, interperitoneal, abdominal, or intravenous. Mechanisms, subcutaneous have slowest effects, intravenous has very quick effects. Central injection, the route of administration. Intracerebroventricular, the ventricular system. Intrathecal, into the spinal CSF. Epidural, under the dura mater. And intracerebral, into the brain region. Mechanisms. This is used to circumvent the blood-brain barrier. This rules out peripheral effects and affects discrete brain locations. Drugs affect each stage of neural conduction and synaptic transmission. Local anesthetics block sodium channels to stop neural transmission and pain fibers. Some drugs alter presynaptic events. Some drugs affect the presynaptic neuron by 1. Effects on the transmitter production, such as inhibition of transmitter synthesis, blockade of axonal transport, and interference with storage. Example, the drug reserpine interferes with the neuron's ability to store catecholamine transmitters in synaptic vesicles. This depletes the transmitter at catecholaminergic synapses. Or 2. Effects on the transmitter release. Prevention of synaptic release, alteration of synaptic transmitter release, example, calcium channels blockers inhibiting the release of transmitters, and alteration of transmitter release through modulation of presynaptic activity, example, caffeine competes with adenosine for autoreceptors, preventing adenosine's inhibitory effects. 3. Effects on the transmitter clearance, such as inactivation of the transmitter reuptake and blockade of the transmitter degradation. Some drugs may act postsynaptically by 1. Direct effects on the transmitter receptors, such as blockades of receptors, example, curare blocks acetylcholine receptors leading to paralysis and death, or activation of receptors, example, LSD is an agonist at some types of receptors. Or 2. Effects on cellular, regulation of the number of postsynaptic up or down regulation, modulation of intercellular signals, example, mood stabilizer lithium changes second messengers, which probably leads to gene expression and receptor density.